While BC prepares for a third Omicron wave, the impacts are already hitting our healthcare system in the province. According to the province, just over 10% of healthcare staff were sick for at least a day last week due to illness. Normally, it would be about 6%, and COVID-19 is partially to blame. Today, BC's health minister addressed plans for a fourth dose.
No option is ever excluded. Right now, we see overall the level of hospitalization coming down from COVID-19, but we also see other places in the world real challenges. So what we're going to continue to do in BC is follow the guidance of public health.
A planned fourth dose against COVID will be rolled out based on federal recommendations that booster doses be made widely available. The third wave of Omicron is a concern for many people in BC, especially those who are immunocompromised. For more on what we can do, I'm joined by Dr. Melissa Liem. Dr. Liem is a Vancouver family physician, and we are very happy to have you here. You're the first guest we've had in 2.5 years in studio, so thanks for joining us, Dr. Liem.
What an honor. I'm so happy to be here.
It's wonderful, and you're going to be our recurring guest, so we're going to be happy to have you here all the time. So first question I wanted to get to, so we're talking about the fourth dose, and it's currently only available for people age 70 and older, Indigenous people over 55, and people in long-term care. But I hear many people saying they wish they had a chance to have the fourth dose. Do you think it should be more widely available already?
I am one of those people who wishes that they had a third dose because my last dose was over 6 months ago. And we know that immunity against infection only lasts about 4 months. So I pretty much feel like a sitting duck. That said, I do trust in public health. And they have said that in the fall is when we may see more of those third boosters. So anyway, I think it would be nice, like if in other provinces like Quebec, if you wanted a booster, you could get it, because I know that we are having expiring vaccines right now. But yeah, I do trust in public health though.
Okay, all right, so hopefully in the fall. What kind of evidence are we seeing around the world about the potential third Omicron wave?
We are actually at the beginning of Omicron wave number 3, and this is really being driven by variants BA4 and BA5. We first saw these in South Africa, but since then it's spread to countries and continents around the world. And really, as long as we have significant proportions of the population that are unvaccinated, we're going to see more and more of these new variants emerging. And the scary thing about BA4 and BA5 is that they evade our immunity. So if you've had vaccination, if you've been infected before, you can get infected with these new variants. So it's kind of scary how quickly these cases are rising.
Wow. So what do you make of some of the projections that we're seeing about what is about to happen this fall?
It looks like actually we may see a peak in BA4 and BA5, the Omicron wave, in August and not fall or winter like we've been expecting. So that's why it's really important to get those vaccinations now.
Right, and we are seeing, of course, people in the healthcare system already feeling that pinch from people being sick, and many people around here in the newsroom as well. So when do you think we might actually see a dedicated Omicron vaccine, something that can target BA4 and BA5 like you're talking about?
That's the million-dollar question, and this is something I want myself, right? So at first, Pfizer and Moderna were saying that we might see data supporting vaccination and supporting deployment of those vaccines in March. But since then, those timelines have been pushed back. So now we're looking at possibly October for public use of the vaccine in the U.S., and then who knows when it's going to make its way north of the border to Canada.
And so what's your advice to people then, for those of us whose vaccines are, have gone past that 6-month date and, like you said, feeling a bit like sitting ducks?
You just have to be really careful with public health measures. So I recommend 3 things. Number 1, stay home when you're sick. So if you do possibly have COVID, you don't give it to other people. Number 2, remember that COVID-19 is airborne. So you want to mask up when you're, especially in indoor public places. Ventilate, ventilate, ventilate. So open those doors, open those windows if you're indoors, and spend more time outside. Outside is better than inside for all kinds of different reasons. And get your vaccine. If you're one of the 1 million people in BC who has not yet gotten their third booster dose of vaccine, you want to get it as soon as you can. Do not pass go. Make sure you're not one of the statistics in this third Omicron wave.
And do you have any advice on how to talk to people, maybe family, friends, who haven't yet gone and had that third dose?
This is a good question. So again, tell them, hey, Omicron wave number 3 is coming and you don't want to be sick with it. And maybe even just talk about the burden on healthcare workers. This is something that I've seen with successive waves, is that nurses, emergency doctors, acute care doctors, even family physicians in communities are really feeling burdened by wave after wave, and we're burning out, and we're really seeing a healthcare crisis. So just think about your community, think about your own safety, your loved ones, vulnerable people around you, and get that booster if you're due for it.
Okay, all right, great advice, and we're looking forward to seeing more of you, Dr. Melissa Liem.
Thanks again.